Good evening, everyone. So I'm going to present something little different, and the blame is on Chitra Madam because she told me not to speak ophthalmology. So this pearl is not about ophthalmology at all. And this presentation is not meant to malign any XY chromosomes in this room. And you're all good men, and it is not my intention to state or insinuate anything to the contrary. So this is a picture from medical school. You have almost equal number of ladies and gentlemen coming in for becoming doctors, and you will find the ladies are walking in front in everything, in academics, in clinics, in all the activities that is going on. But then what happens 10 years later? 10 years later, you will find a room like this. If you just look around how many ladies are there, you can count on your fingers. So what happens to us? What happens on the way? That's what I would like to talk about.
Finally, what matters is the judges are women here. Both the judges are women.
Sorry?
I really don't think you can complain, but anyway.
I think that's just an aberration if you look at the list of the judges. I think
The men judges were kind of afraid. They were like,
So this is what happens to us on the way. So we become doctor moms, and then we are managing everything. We're doing the cooking, we're doing the washing, we're doing the managing the household, cleaning, sweeping, and taking care of our
Super
duties.
mom, not doctor mom.
Super moms, yeah. So we get torn between career and family, and most of the time end up compromising one or the other. But what can we do? So that is my pearl to all of you. It is to the women in this room, maybe not applicable to the ones, all those who have come here, but the younger ones to whom you can spread the message, and to all the men who probably can spread it even better. So the first thing that we have to do is to dream. So we have to dream what we want to do in our life, and we have to try to reach out to achieve that. If you don't have a dream, then there is no point. If your dream is to have a baby and stay with your family and have a good family life, that is good. That is good, and you can achieve that. But if you want to go something beyond that, you have to dream about it. Without that, you are not able to achieve anything. And the next thing is to plan. I find that the younger generation, they do not take the planning into their hands. I have postgraduates in my institute who just become pregnant 1 month after their marriage. Why on earth would they not plan? Why? I don't understand, because it's like they never got into that gynecology class at all. So just plan your family, plan your career, plan what you will do 2 years from now, 3 years from now, 5 years from now, just like the men do. The men have that in a racetrack, while the women have it like some kind of kacha road along the rural villages of India. So that planning has to come, and that includes family planning. And sometimes, in spite of your best laid plans, it can go wrong. So I became pregnant in my final year of PG. The plan was to come out and finish everything by November, and then I'll deliver in February, but I ended up with twins. So things do go a little bit away from your plan. So you should have not only plan A, but B, C, and D. And prioritize. So stop multitasking and prioritize. So when you need to give importance to your family, you give importance to that. When you need to give importance to your career, you give importance to that. Don't try to do everything together at the same time. It is okay to take a break and then come back to it. But in the meantime, you have to keep that fire in you burning, and you should not let the world douse it. That is my message to all of you.
Thank you, Dr. Natasha. I think it was a wonderful message that you've given.
Wonderful time here at DreamCon, and a great life ahead. Thank you to all the trainees and teachers of AIOC LDP, and especially dear Chitra ma'am for everything. She put in a great effort over the last 2 years. Thank you so much.
Thank you.